I know he was.
All right, everybody.
Yeah, I don't know. Yeah.
Getting ready for our.
Turn this down before I get.
Oh, we're gonna call this Health and Human Services meeting to order Tuesday, April 16th, 2024. It is 3:47 p.m. and we are beginning with the Department of Health. Director?
Good afternoon, everybody.
Yeah.
I've just got my report to share with you today. So the month of March, we had 463 investigations, several foodborne, one varicella, invasive food strep A. And other than that, it was very routine stuff. Norovirus outbreak at long-term care facility. We had 50 pediatric flu in the month of March, no hospitalizations, but only 8 of those children were vaccinated. So
March COVID numbers look pretty good.
yes, we like that. 43 confirmed cases in March. As you can see, March tends to be a lower month comparatively in the last 2 years.
Those are in my town.
Yeah.
Yeah.
Yikes. You know, it's hard to compare them to the last 2 years because there were so many changes in surveillance. But we have what we have and we'll keep looking at it. No deaths for March, like that too. And then our wastewater surveillance was quite low. And I think even more recent ones in April have shown even lower than that. All good things. All right. Yeah. Tuberculosis is chugging along, 5 positive quantiferins, and we're working through those. 136 cases of Lyme to date. And then we had 2 rabies submissions, both negative, 1 pre-exposure and 1 post-exposure series completed in humans. 60 environmental health inspections in the month of March, 14 food service as listed on the screen, 39 ATUPA compliance checks, that's tobacco use prevention, 3 migrant farm worker housing, 14 neighborhoods visits, and then 9 individual sewage applications.
Was that $1,700 fine one fine?
Those fines can be quite hefty. I don't know if that's one, but it would not surprise me if that was one single fine because they're fined per item.
Okay.
So you're not, we're.
Hence the single dollar.
Yes. So you're fined per item that's visible. So each like flavored vape that's visible in the store, you're fined. So, yeah. So it can be a lot. I think our largest was like $16,000. So, immunization and migrant programs, 130 vaccines administered to 62 patients. We did our recertification for the vaccine for children and vaccine for adults program. We do have to do every year, 20 doses of COVID. Effective April 1st, we have decided not to repurchase COVID vaccine for adults because we just weren't getting, the interest, and it's just far too expensive to keep on hand. And adults can go to pharmacies. However, we will continue to do children under 12.
I have a question. Sure. What do you do with the patients that cut too big? Where do they, back in the day when I was in the sanatoriums, they were in the positive and the negative pressure rooms. What do they do?
So if it's active TB, we do direct observation therapy. So we have to send a nurse to that person's home and observe them taking the TB meds every single day.
So they're there home.
Yeah.
They're homebound.
Yeah.
Sure.
Yeah. And latent tuberculosis, it's encouraged that they're treated, but they're obviously not the same, requirements of direct observation. Preschool and early intervention, we had our new director begin March 25th. Lauren Clark is with us as our early intervention official. Annual reviews have begun. We have 137 children in the preschool program, 64 active cases in early intervention. And then we also have the EI Hub on the horizon, which I believe I've mentioned here before. It is expected that program will roll out June 3rd, whether we like it or not. There will be a 1 to 2 week downtime in between, in which we will be responsible for ensuring that that data has migrated between systems, which will also probably back up our whole operation quite a bit. We've had one in-person training for the EI hub, and it did not go well. It was, let's see.
Awkward and uncomfortable.
Awkward and uncomfortable, yeah. Painful, yes, those are all good words. It is expected that this may encourage some of the people in our limited provider pool to, not continue with us because it is so administrative intense for our providers in this area, which are not associated with agencies. They're single person operations who are responsible for their own billing and uploading their information to our system, which when the system's putting up a barrier, it makes it very difficult for them, which has us really concerned.
So this is a state system that's being imposed on you?
Mhm.
Okay.
You can mention some of the other barriers for those providers who early intervention, whether it's their own transport, cancellations, and
Yes,
things.
so they're they're not compensated for if they show up to a home and the parent forgot or had another appointment and isn't home at all, or does the child's sick. They aren't compensated for their time, their travel, gas, any of that. So in this county, in rural counties, and this is true for many other peers in other counties, that's a day wasted, really. I mean, they're just out of luck. Larger counties downstate are part of agencies, so they're compensated in some way, but we are rural counties really struggle with this. And it's hard to get people to do it. And St. Rose closing, unfortunately, that was one of our speech providers, and that also trained a lot of our speech providers. And there wasn't a plan for those people who are already in that program, so they're either have to start over in this area or transfer out of this area. So that is also a big struggle and big concern for us.
Wasn't one of the SUNYs going to try and take on the people in that program?
I think there was a development this week that I'm not super familiar with, but up until now, I know that there wasn't any arrangements made for them. I hope that has changed, and that would be great welcome news for us, certainly. PHEP, we're working on updating our volunteer plan, which will directly impact our pursuance of becoming a medical reserve corps. We collected 140 pounds of home-generated sharps in March. One referral in the month of March for newborn, 2 newborn follow-up screenings, and then we installed 3 car seats. Any questions about any of that? All right.
Thank you, Director.
Thank you very much.
Thanks very much.
Up next, we have Social Services, Commissioner Gibson.
Let's be very quick as well.
Hi, Commissioner, how are you?
How are you? You got my message.
I did, thank you very much.
That's no problem at all. So I'll just give some quick updates. I changed this around a little bit. You'll notice I added some employment because I am sort of revamping our employment. It's actually a great unit, but they're sort of upping their game. And they've been getting out into the community and getting with employers, and sort of, we're doing some matching of folks that we think are good for certain jobs. And, we just sort of really want to increase that and be more of a presence at job fairs with our clients, make sure they get there, and it's going pretty well. So employment's still pretty good around here, and we're taking advantage of that. So I just wanted to point that out. We're making that part of our monthly statistics. We're open over on Green Street, and we've had a pretty good crowd over there, and I get excellent daily reports. Both our providers who cover overnight are very well staffed. and each has experience, at least one experienced, staff member with this. We've been able to actually take on folks who have just shown up from the neighborhood, and then we process that the next day. So we're going to be open there a couple more weeks for this year, and it will prove, I think, to be a very good run, dry run for opening full time next year in November. So you'll keep you posted on that, but so far very encouraged over the first 2+ weeks.
Homeless numbers are up.
Yeah, well, they've been up all
I
year.
know, but 140 in April,
I know.
that's a high number.
That's where, that's the kind of winter it was, and our code blue budget had to double this year because of that. And part of that will be me going back to the state and asking, to amend my budget. Because we just didn't see those kind of code blue numbers coming at us, so yeah, very high.
No dance in that.
Why increasing as we're getting into the spring though?
I don't know.
Yeah.
It never really dropped last year.
Yeah, I
But
mean,
it hovered around 100, not 150. We're close to
Right.
150.
I would agree with that. There were times where we were up around 124, we
Right.
dropped back down.
Right.
I don't, I'll say it's not Green Street because we just don't have that kind of capacity there.
So is it migrants?
It's not,
Okay, just want to
it's not,
ask the question.
it is not. It's not,
Do
it's.
you think we're starting to see any evictions that may be contributing to this?
That's
That
part
may
of
be
it.
part of it.
That's
That's because
part
the
of it.
sunset's over.
And remember, and there's so much going on that score, and, we're in a transitional period, right? And I was just talking to somebody about that. I think, and I'm gonna meet with, H&HS, but, they're in a transitional state, and they hope to increase capacity and modernize, and I know, but those plans go slowly. Meanwhile, you can see on your drive down here that more and more buildings are being rehabbed right here in the city. And that equals some displacement.
Okay.
Unfortunately. So those are up.
People are putting up tents and people are
I know. I know, and,
Really?
we'll likely be working together, through the summer on that.
That's the first incident of that in the county though, right? Is tents.
No, but it's the first time you're gonna see it.
They were there last year, and, what do you do? What do you do? What do you do? What do you do?
Well, that's the population you can see.
Yeah.
Remember out behind our agency, you can get little gatherings.
Bob, are some of these clients, before they become homeless, you're working with, I assume, correct?
Some we are.
And is there education to some of these individuals? Because I do know, and of course I don't have any numbers, but I know a lot of landlords that a lot of the tenants don't take care of the apartments, and a lot of the there's bad landlords too, I get it, but that, and they get evicted because of that. I mean, is there education going on, I assume, with your department to these individuals if you do a visit to say, listen, you gotta clean this up, and because it happens a lot, where people say, oh, my landlord evicted me, and then you see what the aftermath was, and you say, well, they're destroyed, or they're,
Yeah. So I'll tell you, excellent question, and it's a sort of a multi-faceted answer to that, because if we've known about it, chances are we are in prevention work. We've done that and kept people in their apartments. It comes at a cost. We often have to hire professional services to come in and clean. I've had to reimburse.
but it seems to me that's a simpler path than to try to find
It's
them
just
out.
less expensive.
Right, than to try to find
I mean, I've
housing
spent
once
$2,000 and
somebody's out on the
$3,000
street.
at a time to keep them in a home because I'll go through that money.
Yes, I get it, yeah.
But good question. So there is that. And then there are those, they were never on the radar before, but that has caused them to do it. And a lot of people are rehabbing right now. Rehab means that the places are not online. So yeah, that's certainly part of it. Okay. There's just a couple other quick things I wanted to do. Oh, so, checked into, two things. Number one, the county attorney has assured me that corporate membership to the Kiwanis Club is perfectly appropriate. So I said, that's great. So we plan to join the one that's up and coming, and that can only benefit everybody. So I'll be joining that. And we had plenty of money left over to do another year on the MDT field workers, and we already have that contract in place. So our budgeting is going to keep us through May of 25. Spoke to the director today. We're going to keep an eye on that, and so take a look at that in January of 25, and see where we're at, and have some stats and whatnot. And, PJ was ready to come speak on that, but that's premature at this point. Okay, so barring any questions, that's my report.
Thank you.
Any questions for Drake?
Thank you, I appreciate it.
Thank you, sir.
All right, Director Graninetti.
Yeah, I just have a couple reports as well. Since Bob just left, we might as well just bring up the Think Differently program. There's a proposal that's been brought in from Cornell, and I think the commissioner was going to come meet with Chairman Morrell and to see if we're looking to have more of a focus, more of a individual attention to it. Because right now it's kind of like patchwork, do a little here, do a little there, trying to find money in this budget, that budget. So I think the goal is to eventually have us be partners with Cornell. So the proposals then.
You mean cooperative?
Yes.
Okay.
So that's that. You want to speak anything about that, Commissioner?
That's something where I was supposed to come down, and I had to cancel a meeting with Matt. Among other proposals, I just wanted to go over with the board. Yeah, I mean, it's a good, we asked them to look more long-term, and we asked them to look for self-sustainability, or at least a match as years went on, and they were able to get something together which shows them an equal match going forward, which I thought was very good. But again, I'll go through that with the board and
then the other, the May 23rd leadership banquet. It's all in place. Everyone's got their invitations. Unfortunately, I know there's a golf tournament that day as well, so that might cause a little disruption. I've encouraged who's ever golfing to come in and have a nice meal and enjoy our event, because there's going to be a lot of good food, and I think it's a really good event. So we're excited.
Don't get too rowdy. This isn't the 19th hole for the day's golf.
Hopefully they come in a little tired. There you go.
And I don't have to cook.
Yeah, they don't have to cook.
I told Vic we had
Higher
5
than air
minutes.
quotation.
I said, you have 5 minutes to speak. He goes, that's my intro. I said, I'm sure. That's why I'm telling you. You have 5 minutes to speak.
Yes.
There you go.
Yeah. So we're excited.
The Gong Show.
We're looking forward to it. With a lot of work behind the scenes, there was a committee that looked at all the nominations, and they're just about ready to identify the winner from both areas. So we had a lot of good participation in the 6 school districts. So they all participated, some more than others, but all 6 schools participated, which was good. The other thing is, for the upcoming summer, I did get an email from the supervisor today. Thanks to the commissioner, we have the Bindlestiff Circus again for the towns and the playgrounds or the camps. I know, unfortunately, last year there was a couple towns that took advantage of it, but it was like severe rain. So if you're interested and you have a date, we've already nailed down Cannon's date, so we'd be glad to help.
And Cannon's rain day.
And Cannon.
You're only allowed one.
We'll only get one, but.
So, yeah, and also, like, we'd like to try to get couple different playgrounds involved with the Bindlestiff Circus as well. I mean, it was helpful last year because, like, yours went through Chad and Culver went through Hillsdale. So the more we can combine them, the better. So that will be coming soon, and I just want to make sure that folks have update to get
Send
some
me
dates.
something and I'll give it to Janice. She'll be back for the
Okay.
meeting. Okay. Please.
Any other questions or thoughts?
Thank you.
No, it's good to see you're gonna partner with Cornell Cooperative Extension with a think differently. I went to one of their small programs with the Anderson Group for the visual education aids and things like that. It was very interesting. Unfortunately, I couldn't stay the whole time, but
Yeah.
they seem like a very good partner.
They're like, they're a hidden gem. I mean, they've really, Director Galena's background is right in this field. She's very familiar with what they did in Dutchess County, and we really seen some good stuff. So we're excited.
And her enthusiasm is so contagious.
Oh, without a doubt.
Right.
Yes. Yeah. So, all right.
Terrific.
Great
Thank you,
report.
sir.
Thank you.
Okay, making her triumphant debut.
Welcome.
Hello.
Welcome.
All right, so bear with me, as we all know, I'm new at this and I'm probably gonna-
But let's introduce, I know you were here with Kevin, but let's introduce the supervisors on this committee.
Kathy Eldridge.
David Helsley, Germantown.
Oh, Greenport. There you go. Yeah.
Brenda Adams. Hi, nice to see you.
Yes.
I'm Bruce.
Love the jacket, by the way.
Yeah.
Two of my favorite colors. Hello. Hello.
And this is the most prolific person in county government.
Oh, yeah, we've spoken quite a bit.
Yeah.
We'll get her going. She's doing great. So we've got two resolutions, quarterly report, and then some updates that you may or may not care about. You can tell me if you like this stuff or if I can keep it out. So first resolution, I think, is the financial, request to accept a grant from the Bank of Greene County Charitable
Second.
Foundation.
Further discussion? All in favor? Aye. Opposed? Carried. A lot of your resolutions will get abbreviated.
We'll make it really
When it
easy
says
for you.
grant,
Yeah.
you may not even get the words out, it'll be, especially if Ray is here.
Perfect, because we scheduled to take the photo tomorrow, so that makes that easy. Next resolution is personnel
Move it.
requests.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Kelly does?
It just means we read the material.
So that means you're gonna cede your casework though, now that you're the head cheese, right?
Mhm.
Okay.
Let me know if there's any spelling errors,
Yeah.
although I do use Grammarly. All right, so the quarterly report for January to March of this year, case management, we served 197 Columbia County seniors for a total of 419 hours of service. Congregate meals at our senior sites were 2,109 meals for 122 Columbia County seniors. Home delivered meals, 13,984 meals to 216 Columbia County seniors. Some of them overlap as well. HEAP, we provided assistance to 117 Columbia County seniors, and that was the completing applications, as you know, because it goes over to DSS. Personal care, 31 Columbia County seniors received 718 hours of service. 23 of these were provided service by our in-house aides, with 497 hours specifically from those absolute powerhouse ladies. Transportation, we gave 2,013 rides throughout the county to seniors in the past 3 months. HICAP, that's Health Insurance Information Counseling and Assistance Program, for anyone that doesn't know. 184 seniors provided assistance, especially with those Humana changes. That was a lot. And then the Everhome Pilot Program, we have currently 48 active cases and 2 pending, and the only wait list we have at the time of this was 1 case in Hudson, which is kind of challenging to find an aid that we're working on. We don't have anyone else added to the wait list as of yet, but I feel like, if I remember correctly, as of yesterday, we filled the last remaining space in our in-house aides schedule. So we would be sending out to aid agencies. So there may be a little bit of a lag on that as we wait for them to be.
How many aides do we have present?
We have 2 full-time and 1 per diem. And they are working.
Did we budget for full-time? What did we budget?
thought it was three.
Really? Okay.
You know, my memory's kind of faulty, but I thought it was three.
Well, I trust her more than mine. That's
I can look into it. This is moving, right? I'm not losing.
Yeah, it's just the table rocks. Yeah.
It's Mark, Eileen, and
You're not shaking that much.
I
You're all
gotta
right.
change the table around.
You're doing fine.
Is it a lock thing?
So,
Are they-
are there any,
Isn't there a lock underneath it though?
in turn, do we have any cases at Everhome that haven't been replied to? Or do we have a clean slate? Everyone we've sent to Everhome is good service.
Yeah, I'll-
Meaning anyone that has been
Referred to,
introduced to the program
Right.
took the tablet?
right,
I don't believe so, but I don't have the numbers
okay.
on that. I could get the numbers.
This is because I know that the last time I spoke to, remind me who the Everhome,
Linda Shear.
Linda, last time I spoke to her, she was having some slow responses from Everhome. I just want to make sure that everybody that was interested had been attended to. responded to.
She definitely has touched base, I believe, with
And I
everyone.
know it wasn't on our side, it was on their side.
Mhm.
Okay, thanks.
Any other questions? Updates, here's the fun stuff. Anticipated community engagement for the next quarter. The only two items that are actually nailed down, well, one already passed, was the NYSERDA Energy Forum last 2 weekends ago, at the Hudson Area Library. Dee Dee Barrett was in attendance. We made some, I would say there was a small amount of people there, not a ton of people, but I talked to everyone that sat by the table, and I think made some connections with, I don't have their name in front of me, the table that was next to Dee Dee Barrett's table through NYSERDA, I think. But they're interested in running some type of pilot program in Columbia County for seniors. So we will be talking about it, and I'll get you more information. I think good connections were made there. May 4th, which is coming up, we have the VFW Mother's Day Market, which is at the Ghent VFW. We were invited to table for free and just get information out about what we do. I believe it's 10 to 2, 10 to 4, and I'll share the flyers once I get them. We're in the process, very early process of connecting with, for Hudson Pride and Hudson Flag Day Parade to kind of have a presence there and pull in, some more of the community that we may not have engaged with previously. And, again, very early in the process of planning to be a part of the Bliss Towers Community Day. So those are our engagement, then our education opportunities, very early in the stages of working with the Sheriff's Office and Hudson Police Department to do some types of talks around elder abuse and abuse prevention at our senior sites. World Elder Abuse Awareness Day is June, I believe, 15th, which is a Saturday. And we know that they're very busy and, understaffed. So we don't have any dates, but it'll be throughout the month of June that they'll be doing those talks. The Hudson Fire Department, is it Tim Hutchings, I believe? I've met a lot of people in the past 2 weeks, so I think that's his name. Agreed to do some fire prevention and cooking safety talks at our senior sites as well. So I'm not sure, it'll probably be over the summer. We have Walk with Ease and Bingo Size with the Health Department scheduled in the next quarter at our senior sites as well. Upcoming events, next week is National Volunteer Appreciation Week. This crept up on me. So we are going to just do thank you notes, handwritten thank you notes to all of our volunteers this year. I'm going to attempt, if anyone will say yes to me, to interview 5 of our volunteers and kind of highlight them on social media, and then utilize that for the website and the newsletter going forward. Hopefully they say yes. And then next year we'll plan something a little bit bigger. Then in May on the 14th, I will be accompanying Pat and Eileen Malloy, who were selected as the 2024 Senior Volunteers of the Year up at the NYSOFA Older New Yorkers Day, which is at the Egg. I'm sure I'll cry because I've known them for a long time. And the amount of stuff that those two have done for this community it blows your mind. I don't know how they have the time. Updates to the OFA website. We've been working with MIS to develop an entirely new layout, update everything on there, add information and resources. We're thinking about adding a caregiver's corner, specifically highlighting the the respite program, which has a longer name that I can't remember at the moment. And on there will be the screener for the respite program so that people looking for information can screen right there, and it'll kind of bypass some phone calls and going through the intake process. They'll get a call right from us once they complete that screening tool. Volunteer opportunities, we want to make a section about that, you know, learn how to volunteer for us. What can you do? Those volunteer highlights, spotlights will kind of live in that corner as well. And we're hoping to switch to more of an e-newsletter and not mail quite so many out. So there will be a section to use a Google form to sign up for the newsletter as well. And I think as of this morning, we met with Blooming Health, which is that communication system that we use. The plan is to do a survey through that, which will hopefully be answered. Asking anyone if they'd like to switch from the physical copy to the e-newsletter.
Don't call it a survey and you'll get an answer.
Yeah.
The survey is gonna go, whoop,
Yeah, we'll just checking
we're
in.
just man.
Senior community centers, we are planning to begin the process of reopening the Philmont site. Early May is when we're going to really kind of dig in and get that going, which I'm excited about. And then there is a fall prevention partnership with Albany Medical Center continuing, and the 24th it'll be at the Canaan site. He's fantastic, by the way. He's a really good public speaker. I like him.
And that was kismet, because we had 3 people in our senior lunch program fall in the 6 weeks prior to that. And we found out about the program and him at the same time. It was just perfect timing.
He's awesome. I would like to think that people are engaged. When I went to the Copig site, people paid attention.
Yeah.
There was some audience feedback. And the last thing that I just think everyone should know is that the emergency heat benefit was made eligible through August 30th, which I think is interesting because
August 30th.
It's typically getting warmer. But okay.
So is this for oil and propane only? So I'm just wondering about electricity for air conditioning.
Which is what I was thinking too. I'm not 100% certain,
Yeah.
but to my knowledge, I think
Just
that's
oil
a
and
separate
propane.
program,
Okay.
which has a fun rhyming name.
Yeah,
Okay.
you can
Alliteration.
send those, you can send them. You have a
Okay, nice. The regular benefit did close on the 12th, a couple days ago. And I think that's all I got for you.
So wonderful to see a report like this. Thank you.
So that wasn't boring.
Not at all. Very informative. Any further questions for our new administrator for the Office of the Aging?
Not at all.
Thank you very much.
Thanks very much.
Off and running.
And certainly last but not least, Director Almasi.
Thank you, everybody. Good afternoon. Hi. Just a couple of resolutions this month. First, we'll start with the personnel resolution. I'm asking for your support to abolish a behavioral health social worker, I believe it's a grade 18C, and create a grade 15, which is a behavioral health care coordinator. We currently have a wait list in that program. I'd like to be able to meet that need.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
On to general resolutions. This resolution is to recontract with Lori Torgerson. Thank you.
Second.
Before we vote on it, I'd just like to understand what progress we've made with Lori's consultancy.
Well, if everyone will remember, with regard to the Wellness Hub initiative, Cheryl Roberts from the Greenberger Center was the unofficial leader of that group. When she became a judge for the city of Hudson, it became unsustainable for her to do so. So we brought on a coordinator in the form of Lori Torgerson. And since that time, Lori has taken the lead on organizing the group, maintaining the group's momentum, scheduling the meetings with certain elected officials on the state and federal level that we've had, and completed not grant applications, but community project applications that have been submitted and we're waiting to hear back on in terms of possible funding. She's also acted as a liaison between RUPCO, which is the developer that I've told you about, in terms of organizing meetings with them as well, and the Greenberger Center, who, as of last week, I was told there is a proposal that was submitted by RUPCO to Greenberger Center The folks at Greenberger Center, namely Francis Greenberger and others, are reviewing that, and I should know more tomorrow in our weekly wellness meeting that Lori leads.
So I appreciate that, and it sounds like she's starting to train things and get things moving. What does that mean in terms of actual progress on the site?
Well, progress on the site is that the land has actually been transferred.
Yeah.
From what I understand, to Greenberger, which is a huge step. There has been, if you remember, there's been some pre-development tasks taken care of. The ground has been deemed acceptable to build on and things like that. But really what we're doing is we're waiting to see if we can partner with the developer, if there's an acceptable proposal from a developer. Now, I believe there was some misunderstanding in terms of the longevity with which we've been working with RUPCO. We first started to speak with RUPCO in the fall of 2023. They did present one proposal to us that was not comprehensive enough, is how I'll call it. They were asked to represent a proposal, which is what I just told you about. So to be honest with you, I'm hopeful and optimistic in this proposal that will speak to both the creation of a housing element as well as a homeless shelter.
So is this still ARPA money? Where's the ARPA money? Because it's 20.
There is ARPA money right now, but it has to be, there has to be a contract prior to the end of this year.
2024, right.
So we understand the urgency of that.
The other thing you may not understand is we had a call with the senior VP at RUPCO yesterday. They had an $11 million Friday last week in terms of the ADU grants, because they're going to be doing them for Ulster, Orange, and Columbia County. So they've got a big bucket of money that they have to work with, and they're doing program management for all three counties.
Yep.
So I just want to make sure that if this is a priority for us, that we're the squeaky wheel, because we're running out of time.
Well, that's why
And they're short on staff.
Right. So that's what delayed their involvement with us as well back in the fall, which had to do with a housing project that they landed in Highland, New York, in Ulster County. So they were very upfront with us and told us at that time that, listen, we're interested. This is right up our alley in terms of the types of projects that get us excited and that we want to develop. But they said, we can't get to you until late winter, early spring. So here we are. They have presented the proposal, the latest proposal, by the requested deadline, which was, I think it was April 10th, and it's been in the hands of Greenberger. So it's unfortunate the timing of this meeting. I wish it was after tomorrow, because I'd have more information to tell you. I'm eagerly anticipating word from Cheryl Roberts, or maybe even Francis Greenberger himself tomorrow morning, to tell us their interpretation of RUPCO's proposal.
So I don't want to be misunderstood. I'm not tying this to Lori. It's just the opportunity to ask for the update.
I understand.
And I also just want to I know that you understand, but I just would like to understand that you think she's the person that is going to be the squeaky wheel that's going to get this done in the time that we have allotted. Because this is a real push now.
I understand that. And you know, I understand there's complexities and nuances and priorities competing for the $1.5 million of ARPA money that was initially allocated towards the wellness hub. That's not lost on me. Would it be unfortunate if that money went elsewhere? Yes, I would say that. Would that grind this project to a halt? No. It doesn't
They've
necessarily.
made some changes to the project to make it
That's right.
more palatable and easier to raise funds, so.
I think
we're
it's a
waiting to
very
see that.
important project. That's the
Well,
reason I'm asking
I'm not
these
saying it's
questions.
not, but they've
Right.
made some changes to make it.
What I believe you're referring
more
to,
effective.
Supervisor Lagonia, is that if you remember, there were 3 legs to the wellness hub. One of them had no reimbursement attached to it whatsoever.
Right.
You know, as Commissioner Gibson would tell you, the homeless shelter will kind of take care of itself because of the revenue or the income that'll be generated by the occupants per se. Housing similarly, the individuals that get housed in the housing that's created would have some sort of ability to pay a rent to the owner of the housing development. A welcome center was the piece that had no income attached to it. So we've agreed as a group to not abandon that, but figure out a way to fold that into the two other legs, the shelter and the housing. So I'm curious to see how RUPCO is going to respond to that piece.
From the county's perspective, and we've had some discussions offline about it. I mean, we're talking probably July, we're gonna have to cut bait in
Right.
terms of, because we're not gonna give that money back. We're gonna use it for something.
Understood. And that's why tomorrow's meeting might be the most important meeting so far, to hear from Greenberger as to whether or not the proposal from RUPCO is satisfactory, is adequate, is strong enough, is what they need to feel secure in going forward.
Have you seen the proposal? Do you have that comfort level with it?
No one is.
No, because this is a
Greenberger
relationship.
sees it first?
Well, it's a relationship. It would be a relationship between Greenberger and RUPCO.
You know, Dan's not in this alone, so let me just chime in myself. We have made those revisions, and we can revise further if we think we are, as they say, halfway across the Rubicon, and we don't plan to go back. So we will get something done. It depends on what. Tomorrow we may hear we have to pivot again, but I think there's enough revenue attached to a homeless shelter that we could build out from there if need be. So we're not coming back the other way. We're going to get across this.
Yeah, thank you, Commissioner, for saying that, because to the point that was kind of honed in on earlier in terms of the spike in the number of homeless individuals, the whole complicated, situation with housing and the costs of housing and what they are, and people living in tents. I mean, some of you seem to be just made aware of that. That's been going on ever since I've been here in Columbia County. It's just showing up in a more in-your-face sort of way, which is unfortunate. But the group is committed to figuring something out so that we have a service, a brick and mortar type of entity at some point in the near future to meet this need.
We don't know what the new numbers would be. The original plan was around a $25 to $30 million project. So with pulling out that third leg and now having just two legs and combining and rolling some of that into those, we haven't seen it yet.
Certainly brings the number in a favorable direction.
But let's say Mr. Greenberger agrees, then it would have to go to the county to see if it meets the county's needs, right?
Well, it would, and bear in mind that, the reason that this model is attracted to the county is the developer goes out and gets the fund.
Right.
And RUPCO has, as you, I think, very adroitly point out, that's what they do very well.
Right.
And if they accept this project, it's because they know, what, we will get the funding for this. We're very confident revenue follows this, so we will put this out there.
Okay. I just believe very deeply about this project, so I would like to see it move
I
forward.
appreciate that.
And I would also like to see it move forward, if possible, with some of the ARPA funding, because that falls under the public good as much or better than anything else,
Thank you for saying that. Where did we leave off?
Motion and a second, I believe. Now, further discussion.
No, thank you.
Going on. Sorry, all in favor? Aye. Opposed? Carried.
Second general resolution is just to recontract with one of our psychiatrists, Dr. Tom. The need, of course, remains, so I ask you for your support to extend her contract for another term.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
And the last general resolution is something that we've talked about in here previously, but this codifies the creation of the contract for the Oxford House model, which that's an initiative that will bring a peer-led housing opportunity for individuals with substance use disorders. Now, what we have been able to do is share the cost between Columbia and Greene County. So Greene County is investing the same amount on their end, for the coordinator position. So we're splitting the cost of the coordinator position through Oxford House. And then each county will be committing to one house and communicating with Twin County Recovery Services, who provides the residential housing or recovery housing right now through the Red Door here in Columbia County for men and Riverside for women in Greene County. I've been assured by their residential director that they could easily fill one house for women and one house for men and then some. So my counterpart and I, Jason Fredenberg from Greene County, agreed, let's just start in a cautious and judicious way with one house in each county and go from there.
But then would Red Door go away?
No. What this would do is act as a place for individuals that are in the Red Door or Riverside to be discharged to.
Okay.
Right now, the director of
I remember
residential
that now.
services,
I remember.
she said that nowhere for them to go. She doesn't want to discharge them homeless, which would be a setup for their recovery and such.
I'd like to move that motion or resolution.
Further discussion, I just have one thing, and I think when you brought this in front of us, you know, we're talking about some of this 90,000 being administrative and was 20,000 dedicated towards the structure itself. Is that still sufficient, you think, in this
Yes.
area to secure
Well,
the residents?
the 20,000 is to set up the house, not to pay the rent. The individuals that occupy the house are the ones that pay the rent.
Okay.
So they have to have some sort of income, whether it's through salary, wages, some sort of benefits that they're receiving. You know, all of that is determined as they enter. They know what their weekly expectation is to contribute. The 20,000 is to, you know, let's think about it. You have an empty house.
Outfit the house.
Outfit the house. You need to furnish it. You need to drapes, blinds, dressers, bedding, beds themselves, mattresses, cooking utensils, soup to nuts. The house has to be set up. So,
Washer, dryer, refrigerator.
right, with the cost of things nowadays, 20,000 initially sounded a lot to me, but no, not really.
Oh, the $3,000 refrigerator.
No, exactly. Thank you for. So
So we have a motion.
Motion and a second, all in favor? Aye. Opposed? Carried. Very nice.
Congratulations.
thank you. I'll be happy to report on this. Yes, so you have the overtime report here. What are the numbers? We start with a $12,000 budgeted amount. It brings us down. We've only used a little bit of it, 1162, bringing us to 838. So we're looking pretty good as far as I'm concerned to the overtime budget. And then this image here is a follow-up to, yeah, I think we can. One more.
Gotta go around.
Your request of me last time was to ask the sign maker to make it more proportionate. The 325 Columbia Street was disproportionately large. So it's been brought into a better scale, and the actual signage that will include the occupants of the building has been made a tad larger. I also reached out to Ray Jerkowski directly. I have not heard back in terms of Ray telling me whether there's any hindrances from the city of Hudson to, you know, for example, place it where it is placed in this image and such. So I'll continue to reach out to Ray just to get that assurance. But at this point, I'm asking for your support to go ahead with this for signage here on the sidewalk, excuse me, and also on the building. That's not pictured here.
That's what I
But
was gonna say. Did you alter the signage on the building? as
yes,
well?
that will also be brought into proportion.
And that's double sided, right? So you can see it
This
from the
this will
parking
be
lot.
double sided, absolutely.
And
yes.
is there one on the other far side of the parking lot or just this one?
No, just this side
Okay,
on Columbia
good.
Street. I figured with the one that we're gonna put on the building itself, people coming through the alley will see the back side of this sign, or the one that will be on the building by the main doorway. You know, I don't wanna splatter the whole area with signage. I just want some signage.
Are those all the departments here?
No, this is old. I'm working off of an old rendering that I gave to the sign maker. This desire to have a sign was championed years ago, and that's what this is from.
So I would support or move that subject to the Hudson Code Officer approval of the location and size.
Okay.
Because I know Hudson does have zoning laws and I don't know why the county would be exempt, sign laws. I don't know why the county would be exempt from those sign laws.
I understand. All I know is I was told, and I guess I should get it straight from the person, and not believe the hearsay, but it was told to me that, conversation was had with City of Hudson and we were good to go. But I'll get that, for myself. I'll verify that for myself.
Our peace of mind,
Yes, thank you.
yours and mine.
I'm happy to give you that peace of mind on this one.
And I'll second that motion.
All right, very good.
You're taking it, obviously, Office for the Aging, but, records management as well.
Yes, all tenants, remember, I surveyed all tenants of the building. Holly was very enthusiastic about this. Any tenant that wants to be will have their information on there. And, if they have a logo or a seal, we'll put that on there as well.
And that, Columbia Streets has street lights, right? So it's lit. We don't have to light the sign because the lights in the area will light the sign.
Right, that parking lot is lit, so I think that, that ambient light will carry over
Okay.
enough so that, you can see it as you drive by slowly, I hope. If we wanted it illuminated, I don't know if
I think it's lit enough.
yeah, I think so.
I believe there are streets, all the streets in Hudson have streets.
Yeah, that's what I was thinking too.
So a couple of things, if I may, just, to run past you and,
Dan, I just think we had a motion in a second, so we might as well. All in favor?
Aye.
Opposed? Carried. Very nice. Thank you.
okay. So, this is late breaking news that I wanted to share with you, which didn't make it to the agenda, but, we will in the near future have a new service provider coming to Columbia County, in the form of Astor Services. Astor Services is based in Dutchess County. Some of you may be familiar, some of you may not. They provide children's services, mental health, behavioral health type services. And they applied to an RFP that the New York State Office of Mental Health was putting out there for a service called Home-Based Crisis Intervention. It is what it sounds like, which is this is for children, school age on up to 18 years old. The intent is that they provide a really targeted, specific dose of intervention to a child and their family who are at risk of hospitalization, in an attempt to divert that child from being hospitalized. In our case in particular, let's remember, we do not have adolescent psychiatric hospital beds. So often that child can wait in our emergency department here at Columbia Memorial Health for days, not hours, days. Not the best place for a young person to be waiting before they find a bed for that young person elsewhere, either at Four Winds, Katona, or Saratoga, or somewhere else throughout the region. So having a service like this that's going to work closely with the family, also the existing service providers that are already involved with that child's care, is really, really exciting to me. There's no redundancy, there's no overlap. It's going to be different. And this doesn't involve insurance either. This is funded through the state. So this team will be able to work free of the constraints that sometimes insurance is put upon providers. So just wanted to let you know about that. Yes.
On that, so,
Yeah.
so that's interesting. How does get matched?
We're not there yet because they met with me once as the director of community services just to inform me that they would be applying as a courtesy. Now that they've been awarded it, I'll be inviting them to the mental health substance abuse subcommittee to come and talk with us more as the group of providers. Natasha Robinson, the head of my children's SPOA single point of access committee, will be inviting them to be partaking in children's SPOA committee that meets monthly to talk about high-risk youth and where they should be placed and how we can help them and such. So there's definitely going to be more
Could we
information.
make referral?
Yes,
Oh,
yes,
All right, a question from the virtual realm from Supervisor Cousin.
yes.
Just a comment. I'm really excited to hear about Astor coming to Columbia County. I think some of the big gaps in mental health services for young people are around autism, spectrum support, and around psychiatric support. So it's really good to hear that that's coming to the county.
Thank you for that validation and support. I appreciate it. I'm excited as well. And then the last thing I just want to talk to you about is the I believe it was this Health and Human Services Home Committee that asked my predecessor, Michael Cole, back in 2017 to create an addiction epidemic response plan. And there was a version of that that was then updated in 2021. That version I've taken a look at and I forwarded it to Kelly, who can then share it with you. But, it's outdated. So I'd like your support to just kind of pursue working with providers and a group to bring it up to current standards. A lot has happened in the 3 years since 2021. Some programs no longer exist, others have been created. The landscape is very different, even in terms of, again, we called it addiction epidemic response plan because we didn't want to be too specific on the opioids. But with regard to opioids, some of you may find this surprising. People are no longer overdosing from heroin.
It's good, no.
Thank you. Yes,
It's all over the paper.
it's fentanyl, it's carfentanil, and it will be soon xylazine, which is even more potent than fentanyl and carfentanil. Where this will stop, I have no idea. But the reality of, people's pain and them wanting to medicate it in some way, and the overprescribing issue, and the pharmaceutical companies, despite being slapped on the wrist heavily by these class action lawsuits, all of that is still in play. So how this is going to shake out, I don't know. But, we are still doing a lot of amazing work that I want to have accurately memorialized. Should anyone want to, understand it, know it, read it, I want it to be here in an accurate document.
Was this a discretionary? Did we decide to do this, or is this something that was
I believe
mandated?
we decided to do it
Okay,
based on the circumstances at the time.
okay. So this is terrific that we've taken that initiative, and
Yes.
I'm sorry.
No. Is it domestically, this new threat, is it domestically produced?
All the above, but mostly through South America through Mexico.
But China's the source of the chemical that's
So
sending it to South
there's
America.
hope we can start to block it at some point and drive it down.
One would hope, but where there's a want, there's, that's the problem. We don't have time and I don't want to get into it, but the reality of this, and this was talked about at a panel discussion out at Ichabod Crane, I believe it was, Senator Hinchy that hosted it? I should know I was there, but, Americans' thirst for something to distract themselves from themselves right now is greater than it's ever been. Whether it's alcohol, gambling, drug addiction, we have to ask ourselves what's going on that we're looking to alter our mood constantly from what it is. Because today it's, fentanyl, tomorrow carfentanil, then xylazine. There will always be something. So we're doing everything we can here locally to mitigate it. I can assure you of that.
So thank you for updating that, and looking forward to both the original plan and the update, because I'd like to.
Kelly has the latest version to share.
I sent that out before the meeting.
Okay, thank you.
I got through a couple pages, but I didn't have time.
But for what it's worth, I appreciate the desire to want to read it, but it's an inaccurate read at this point. So
It's a baseline for some of us who may not
It is.
even have this information.
that's right, Eddie.
Would you like a motion from this committee to sponsor the contemporization of this? Or are you,
I would appreciate it if that's necessary and indicated, but I'm okay going forward doing
Do
this
it as
work
a sign
anyway.
of support.
I'd be more than happy to if someone would like to make the
So
motion.
moved.
So a second,
Second.
further discussion. All in favor? Aye.
Thank you.
Opposed?
Yeah, appreciate it.
How long do you think it will take? Okay, 6 months, a year?
Let me get started and I'll give you an update. How's that?
That's about it.
I
I will entertain questions or comments from the public. There being none, I'll ask for a motion to adjourn.
So moved.
Second.
All in favor?
Aye.
Thank you, everyone. I'd like to call the Public Safety Committee meeting for April, please. First one up is probation. Good evening, everyone.
Good evening.
I hope everybody had a chance to review our annual report. And I'm here to field any questions that you might have.
Any questions from the committee?
This could be a quick motion to accept.
Second? All in favor?
Aye.
Opposed? So
There you
carried.
go.
Thank you.
Thank you.
Thanks, guys. Public defender. Mr. Zoni? Evening, everyone.
Good evening.
Have one general resolution, asking grant permission to Chairman of Columbia County Board of Supervisors to sign a yearly contract with the New York State Defender Association for our case management system.
Move it. Second. All in favor?
Aye.
Opposed? So carried. Thank you, everyone.
Thank you.
Thanks. Emergency management.
Thank you. I'm glad everybody, survived the eclipse and the earthquake. Actually, there were two. Well, the second one, they didn't get back to me. They thought it was another earthquake and not just a.
Oh my God, I was bad.
Aftershock, but,
Look at that.
there wasn't any serious effects from it.
I'm
And,
like it like that.
I think we had one little piece of brick fall off one county building. Right as soon as I heard about it, I was talking to, Brian McDonald. He already had his people out checking the buildings.
It was 610.
Some building, what's that?
It was 610, wasn't it?
No, I don't know. I don't think so. I'll have to ask him. He did tell me, but I don't remember. He said just a little piece of brick fell off.
I know Ray Zukowski went to every building as well.
Yeah, they went to every building. I was on the phone with the chairman and, so there wasn't, and I didn't hear of any in the community, so. We also had a pretty significant storm over on the east side of the county again with, a lot of power outages. And I wanted to thank the sheriff. His lieutenant helped me with a sheriff's patrol to check on something that involved, some people at DSS had housed. And also, Ray Jakowski and Tony, DeMarco, because, they had to actually plow up into a place so we could check on these people and potentially, transport them out. As it turned out, ISIC was able to get the power back, so we didn't have to transport them. But, and do you have any questions on, the annual report?
Any questions? Thank you.
Thank you.
Do we move to accept the annual report? Yeah.
Fire,
That's fine, no.
welcome, George.
I'm here, thank you.
I got nothing but the year-to-date report figures and unless somebody's got questions or concerns about something else.
Any questions?
Update on firefighting foam reimbursements for the ones that had already purchased it.
I thought they've been reimbursed.
Have they?
As
The
far
last
as I-
time I checked here, you were gonna look into
far
it.
as
No,
I-
we did.
As far as I know, they went
He
out.
said he had emailed you,
We did find that there was another town, which was Stockport,
which we paid,
which we,
Okay.
paid.
no, well, they're,
No, they're trying to get rid of it yet.
they're gonna get rid of it. We told them to issue a bill and then we would reimburse them, which we'll have to bring to all of them.
So I did reach out and you had no requests, correct?
Well, the request for process.
That's what I meant, right?
Yeah.
All right,
So we're
but
gonna-
LVPA was one that got reimbursed.
We should have.
Okay.
Supposed to have.
Thank you.
Okay.
Chairman, we're going to
Yes, please. Oh, sorry.
Have you had some feedback from the fire companies on the fish report?
I have.
Are they, PG enough to ship?
Sure. We're having some more discussions next week at the battalion meetings, but I have heard from a few chiefs throughout the county. They don't quibble about much, except they're concerned about some of the numbers they don't think are as factual as they'd like. But once we talk about how it's an average and it's, well, it's a more global picture, not a specific picture for any town. It's really more of a 30,000 foot view of the whole system, not just one fire company. Once we get past that, I think we'll be fine.
Thank you.
Thank you.
And then you were gonna pull together some meetings. Is that what you're
Yes,
talking about?
yeah, we got the fire advisory board tomorrow night where we'll discuss it again, and then battalion meeting is the 25th and 30th.
Okay, great.
So we'll discuss some more. Yeah.
Okay, thank you.
All right.
Thanks, George.
Sheriff.
Good evening, everyone.
Good evening.
Unfortunately, I don't have such a short list like my predecessor.
Try to get him a fine.
Thank you, George. Welcome back to Florida.
The first resolution is to authorize the sheriff's office to fill a full-time corrections officer.
Second. All in favor?
Aye.
Opposed? So carried.
Second, authorize sheriff's office to fill 2 deputy sheriff's positions.
Second. All in favor?
Aye.
Opposed? So carried.
Third is to authorize purchase of required equipment to have internet installed in the jail. This is going to be able to complete the project that we started probably ended last year with VI2, the iris recognition system, and part of our MAP program to ensure that the incarcerated, we're making sure that proper incarcerated are getting the medication. So this is going to allow us to put the iris system onto the med card. This is, we're getting some money from the Sheriff's Association, and the remainder is coming from our budget, 10,000.
Move it. And Jim Bragg identified the money, so we're good.
Second. All in favor?
Aye.
Opposed? So carried.
Authorization of Sheriff's Office to purchase CPR mannequin training kit. That's not a misspelling, that's the way they actually market it. We've talked with some other county agencies and departments. We're gonna be offering CPR AED training throughout the county once we are able to get these mannequins. Currently, we're borrowing mannequins to do our CPR first aid training, which is required for our first responders. So just looking to get the authorization to purchase those.
I'll move it.
Second. All in favor?
Aye.
Opposed? So carried.
Thank you. Out of county inmate report. Dutchess County received $2,790. Green County, $8,700. February total of $11,490. Year to date, $34,245. Year to date previous was $103,160.
For the same time frame,
That,
January through March.
I would think it sounds that way.
it is because we had the influx of Dutchess County last year, so. We did, include another report. We're gonna start including this. This is our security services report. I can go over it if you want, but it's pretty much self-explanatory. It shows each building what the numbers, currently are, to March, end of March. And then the contraband that's been, prevented from entering those, buildings, and as well as incidents and arrests correlated to the specific buildings. Any questions we have to answer?
I have one more question on the revenue for the transfers from other counties. And I know I was part of the budget process, but I don't remember. Did we plan on this? Like, we didn't budget revenue as if it was going to be, 103,000 in 3 months like it was the previous year. We're not taking in way less than we thought we would.
No, because we knew Dutchess County's, the influx of incarcerated based on their, renovations to the facility was gonna be not bad.
So the actual revenue for 24 is about what we were expecting.
Yeah, I think it might even be a little bit higher than what we were expecting.
Okay.
It's not an exact science, but it's.
No, I know. It's just sometimes,
Yeah.
I know in my town, if I see we thought that wasn't good.
Where's that money going?
Just want to make sure we knew that was going to be dropping.
Any questions for the sheriff?
Yeah, one more thing. Can you
Sure.
go back to this, the security services statistics? Appreciate the new data. It's great to see more information. That top line, I think the way it gets photocopied, it's not legible.
Yeah.
Oh,
We can sort of update
okay.
that for next time.
all right, yeah, we can definitely make sure that,
I could make out DMV and.
yeah, so the first one's a courthouse, second one's DSS. The third one's 325, which is human services, and then 610 State Street, DMV, and the last is 401.
Okay, thank you.
All right, and I'll be happy to, if you want to get a hold of me.
If they probably just lighten it when it's scanned, it gets scanned in.
Change the
It's probably like gray or something,
Change the
right?
font.
Any other questions?
Probably a stupid question,
Thank you,
but
Sheriff.
what's a mag count?
It's magnetometer.
How many people walk through the
Thank you.
metal detector?
Metal.
Thank you.
Thank you.
Thanks, sir.
I didn't even recognize, see those up there.
This is here.
Where's that?
So I can make a
No, it's not
DMV
DMV.
about it.
Okay.
Because technically he's not asking for it.
Yeah, so resolution numbers for the district attorney, I'm not sure what resolution number
Well,
it
yeah,
is.
we'll have a number yet.
Right, authorization to increase the district attorney's salary and amend the 2024 budget. This was done through the legislature, it's not through the county, and according to our controller, the state will reimburse for the difference.
Will this be retroactive to the first of the year?
Yes.
No, it's
Oh, I
effective
thought it
4/1.
was. No? Okay.
4/1?
It's effective 4/1.
Oh, yeah,
Okay.
sorry, effective 4/1, yes.
They have, the DA has to have the same salaries.
That's the county court judges.
I'll move it.
Second.
All in favor?
Aye.
Opposed? So carried. Any questions from the committee? Any questions from the public? Motion to adjourn.
Someone's
Second, all in favor? Aye. Opposed? So carried.